Today, we're diving into a really fascinating therapeutic framework called Diurnal Microbial Entrainment Therapy, or DMET for short. Now, the core idea is simple, but it's incredibly powerful. What if we could restore our metabolic health, not by fighting against the body, but by resyncing its deepest internal clocks? Let's break it all down.
All right, so here's the game plan. First, we'll look at why our bodies are so out of sync in the first place. Then, we'll dig into the gut's hidden clock. From there, we'll explore how DMT actually harnesses this rhythm, see how it works in practice, and then, we'll wrap up by looking at what all this means for the future of timed medicine.
Okay, to really get a handle on this new therapy, we first have to understand the problem it's trying to solve. And the truth is, a lot of us are living in a world that has just fallen completely out of sync with our body's own innate natural rhythms.
So the central concept we've got to wrap our heads around is the chronobiome. Now, don't think of it as just a host with some microbes along for the ride. Think of it more as a single, rhythmically coordinated superorganism. In this system, timing isn't just a minor detail. It is absolutely fundamental. When that whole orchestra is in sync, our metabolic health just follows.
But modern life, with its late-night meals, crazy sleep schedules, and that constant blue light from our screens, it's just a constant barrage on this delicate system. And this isn't a small thing. This chrono disruption is now understood to be an active driver in a lot of metabolic diseases, especially obesity and insulin resistance.
So, how does the body naturally keep time? Well, it turns out the gut has its own master conductor, a really powerful time giver that sets the daily rhythm for our entire microbial ecosystem. And its headquarters? The liver. See, in response to your eating and fasting patterns, your liver synthesizes and secretes bile acids in this really robust daily rhythm. And this daily pulse of bile acids? It acts as the primary Zeitgeber, which is a fancy word for time giver, for your gut microbiome. It's literally signaling when it's time to work and when it's time to rest.
And you can see that beautiful rhythm right here. Bile acid concentrations surge during our feeding window, which creates this potent selective pressure in the gut. Because bile acids are kind of like detergent, this high bile environment basically determines which microbes can survive and thrive and which ones can't. Your liver is literally sculpting the microbial landscape hour by hour.
This daily pressure creates two totally distinct microbial shifts. During the day, that high bile environment favors the bile-resistant firmicutes. These are our butyrate producers, and that's a fatty acid that is critical for fueling our colon cells and maintaining a strong gut barrier. This keeps systemic inflammation down. Then, at night, when the bile levels drop, the bacteroidetes take over. They produce propionate and acetate, which are key signals for regulating our satiety and host metabolism, directly impacting things like our insulin sensitivity.
So we have this amazing, natural rhythm that's designed to keep us healthy. But what happens when it breaks? And maybe more importantly, how do we fix it? Well, that brings us to the core therapeutic strategy here.
The core idea behind DMET is just elegantly simple. Instead of just throwing more microbes into the system with a standard probiotic, the goal is to use scheduled, timed symbiotics, that's a mix of specific probiotics and the prebiotic fuel they eat, to act as therapeutic time givers, actively reinforcing the healthy rhythm the gut is supposed to have.
And this really represents a huge shift in microbiome therapeutics. For years, the focus has been on composition, who is in the gut. DMIT says, hey, maybe we should focus on dynamic function. What are the microbes doing? And just as important, when are they doing it? It's all about restoring the rhythm of their activity.
So how does all this theory translate into a practical protocol for a patient? Well, it's a structured three-pillar intervention, and each part is designed to work perfectly in sync with the body's natural clock. This framework here shows how all the pieces fit together. You've got these timed inputs, a morning and an evening symbiotic, and they're amplified by a consistent eating window. The end result? A restored rhythmic production of those key short-chain fatty acids, which is the ultimate driver of better metabolic balance and a stronger gut barrier. The whole therapy is built on these three synergistic pillars. First, you've got a morning symbiotic to amp up that daytime butyrate peak. Second, a consistent 8 to 10 hour eating window to stabilize the host's own circadian signals. And third, an evening symbiotic to boost that nighttime propionate and acetate production. Okay, let's look at the specifics of the design. The morning symbiotic pairs a bile-tolerant Firmicutes strain with its favorite food, resistant starch. Why? To maximize butyrate production for gut health.
Then the evening dose combines a fiber-degrading Bacteroidetes strain with a soluble fiber like beta-glucan. This is all designed to boost propionate and acetate, which are so crucial for systemic metabolic signaling and improving insulin sensitivity while you sleep.
Now, it's so important to stress this. Time-restricted eating, or TRE, isn't just some optional add-on here. It is a critical potentiator. By enforcing a consistent feeding and fasting cycle, TRE amplifies the liver's own bile acid signals. This basically primes the gut environment, making it way more receptive to those timed symbiotics.
All right, let's switch gears and go from theory to the clinic. As a future clinician, how would you actually implement and manage this therapy with a patient on day 1?
So a clinical rollout would follow a pretty clear checklist. First, you'd work with the patient to lock in a consistent 8 to 10 hour eating window. Only after that's established would you introduce the symbiotics, and you'd always start with a low dose and go slow to manage any temporary GI symptoms like bloating. You'd use things like symptom logs to monitor their response and, crucially, to track their adherence to the timing of it all. That's key for success.
Of course, we have to be realistic about the practical barriers. Getting patients to stick to a timed regimen, that's a huge challenge. On top of that, everybody's gut microbiome is so different, which means personalization might be needed down the line. And finally, managing those initial GI side effects by starting low and going slow is absolutely key to keeping patients on board.
And it should go without saying, but patient safety is everything. Any probiotic strains used in a clinical setting like this must have a proven safety record and meet really strict regulatory standards, like being generally recognized as safe by the FDA.
All right, let's zoom all the way out. What does this approach really mean for the future of microbiome therapeutics? Well, it represents a genuine paradigm shift.
Okay, here is probably the most important takeaway of this whole thing. The goal of DMET is not permanent colonization. We know that's a massive, often impossible hurdle for probiotics. Instead, the goal is something called metabolic imprinting. It's about transiently but consistently steering the function of the existing microbial community, day in and day out.
This entire framework really forces us to ask a pretty provocative question. In managing chronic metabolic disease, we focused almost exclusively on the what: the drug, the supplement, the diet. DMET suggests the missing key might have been there all along, hiding in plain sight: the when. Is timing the next great frontier in medicine?